quality and quantity of life. So this is good. Now
Thank
we're
you.
talking tips to help you poop. Constipation. Before we go into the causes and things like that, what is constipation? They're different. You're like, well, I've always pooped once a year.
Yeah.
That's almost me. What's constipation now?
Yeah, so there is actually like a textbook definition of constipation. But what I will say is I have learned over the years that it can be a very subjective thing
Mm,
as well. So I can't rattle off the textbook definition, but it's something like having only, one bowel movement every few days, and that
okay.
lasts for like a chronic period of time, like over 2 to 4 weeks or something like that. It also talks about, the texture of the stool, whether it's like very firm and desiccated, whether it's small pellets. So there are a multitude of definitions. But essentially, when I get a person in that feels constipated, it essentially means that, you know, they only have 1 to 2 bowel movements per week, that
Okay.
they're firm or hard bowel movements, and that they don't like the way they feel. So I have
Mhm.
people that only have bowel movements 2 times a week and they feel fine. So technically they are constipated, but they don't seek treatment for it because they don't feel bad about it.
Okay. Okay. Thank you for explaining that. I know they have pictures and stuff of different
Yeah,
types of
the
birds and
Bristol
stuff.
stool scale. Yeah, I can pull that up for you.
We're good. We're good. Thank you. All right. So, what would you say are the common causes of constipation that people may not be aware of?
Yeah, so there are actually different types of constipation. And the most common cause is what we call normal transit constipation. And is the number one reason for that is essentially dehydration and low fiber diet. So most of the time when you see people and it's your kind of run of the mill constipation, that's what we call, like I said, normal transit constipation, and can almost always be treated with increasing intake of water or hydration and increasing fiber in their diet.
Okay. Let's talk specifically about that. Because people are like, oh, fiber? Yeah, sure. I eat fiber.
Yeah.
A bar. It's a bar. I eat.
Yeah.
So
So
what fiber? What is fiber? What kinds of fiber? Give us examples.
yeah. So, there's soluble fiber and insoluble fiber, and we could sort of get into the depths of all of that. But essentially, and again, my recommendations for people has evolved actually over the years, and specifically within the last year in my private practice.
Okay.
What I find with a lot, I'm going a little bit off topic. What I find with a lot of people who are sort of obsessed with their bowel movements, they often have sometimes um, issues with their relationship with food. And so what I have learned is to see if I can have and I've learned this from a dietitian that I work with, sort of a food first approach to healing the gut.
Okay.
And so that means not talking about restrictive eating. It talks about more adding things to your diet that can
Right.
help. So when it comes to fiber, we all know, okay, vegetables and fruit, yes, those have fiber, but a lot of the time people either don't like vegetables, they don't spend time to cook vegetables. So we try to think about other things that you can add in to your diet that add fiber. So some of those things are beans. Beans have excellent sources of fiber. Certain grains, the whole grains have excellent sources of fiber. Avocado, we're in Texas,
Mm-hmm.
people like guacamole. Adding things in like avocado is a great source of fiber as well. And then also talking about adding in fibrous food that is within the context of a culture. So, we're not telling people, to eliminate things from their diet that is very specific to their culture. So we'll say maybe try adding in things like chickpeas if that is, part of, their cultural diet and things like that. So my first thing that I tell patients when I'm talking about adding in fiber will always be a food first approach. And that's to start easy. Start adding in one fibrous thing a day, add in an apple a day, add in, another fibrous food, per day. And then every week you kind of try to add more. And that helps with a lot of patients too. If adding it in dietary wise is not possible, for whatever reason, then we go to the supplements. So sometimes you'll need a supplement like Metamucil, that's psyllium husk. Metamucil is kind of the most common one, but that's called psyllium husk. You can do it in the form of a powder. They often sometimes will come in gummies, sometimes will come in tablets. In people that don't tolerate psyllium husk, there are other forms of fiber. There is, you've probably heard of benefiber. That is a wheat gluten fiber. So people that are gluten sensitive, that is not a good one for people that are gluten sensitive, but benefiber sometimes works for people who are not gluten sensitive. Another form is called citracil. That's methylcellulose, another type of fiber. So if one type doesn't work for people as far as a supplement goes, you can try other forms. And then the last one that I tell people that tend to have pretty sensitive GI tracts or maybe suffer from IBS is a fiber. And I've tried all of these. So I never recommend things to patients that I haven't also tried. But another one that I recommend to people, and you can get it on Amazon, you can probably get it at Whole Foods, is something called sun fiber. And it's guar gum. And that one I really like for a couple of reasons. Number one, it has no taste. So it doesn't have that highly orange kind of processed taste that sometimes the Metamucil, those orange, and those have a lot of sugar in them. So you sometimes have to be careful with patients that have blood sugar control issues. But this one does not have all of that sugary taste. It has no taste at all. So you can put it in water. The other thing is it dissolves really, really well. Sometimes you'll find fibers, they'll pseudo dissolve and then they just kind of glob into a gel. And then it's like, people aren't going to want to drink it, obviously. This one, and I've tried it in my own coffee, has no taste, dissolves all the way. And if you set your coffee aside and drink it a little bit later, it hasn't formed a gel. So it is a low fermenting fiber, the sun fiber. And so people that tend to get bloated from fiber, this one doesn't really cause that kind of bloating. So
I like it. Sun fiber.
Yeah, it's on Amazon. And again, I'm sure you can get it at Whole Foods or something else too. But that one's that's kind of an easy one for people because it dissolves really easily.
All right. Awesome. Now let's talk about, you touched about it earlier. Is there any role for hydration? Can we talk more about that in promoting healthy digestion and regular bowel movements? What would you say when it comes to water intake?
Yes, absolutely. So fiber works best when it is coupled with hydration. So the way fiber works is it goes into your GI tract and it also draws water in from your blood vessels into the GI tract to essentially kind of lubricate the stool so it can form like a bulky poop so you can have a bowel movement. If you take a lot of fiber and you don't drink a lot of water, you can actually sometimes cause the opposite and cause more constipation. So if you're eating fiber or taking a fiber supplement for the purposes of constipation, you have to chase that with hydration. Otherwise, you may make the constipation worse.
Okay.
Yeah.
All right. Good to know. Good to know. So water is really important because you got to pull in the water, helps with the flow of the fiber down the pipe.
Yes.
All right. So next question for you is, are there any other lifestyle changes that you recommend to help with regular bowel movements, such as maybe sleep, stress management, exercise? Have you seen a relation with the two?
Yeah. I'm going to be honest. There probably is a sleep cortisol situation that makes your gut much happier. I actually don't know the answer to that question, but what I will say is toilet hygiene. So what is that? That means when you go to have a bowel movement, the best thing that you can do is, number one, don't sit on the toilet for prolonged periods of time. If it's not happening in the first minute, it's not happening. So get up and go. If you sit on the toilet for prolonged periods of time, you run the risk of suffering things like worsening hemorrhoids, potentially anal fissures, or anal rectal pathology that you kind of don't want. The other thing is straining. So straining can also sometimes make constipation worse because when you strain, you're actually tightening the muscles of your pelvic floor. You're squeezing them. And what you need the pelvic floor to do is actually relax. So if you're straining, it's kind of like, all right, you've got this bowel movement that's not coming out. So you're trying to push it out. And then you're just like hitting against a closed door. And so that's not going to work either. So what I recommend, and I recommend this to everybody that comes into my office with constipation, is something like a squatty potty. Now, you don't have to like run to Amazon to get your squatty potty. You can just get the Amazon box from the thing you just purchased. Put it put it at your feet. Put it at your feet. Get your knees up above your belly button. What that does is it changes the anorectal angle. It straightens it out, helps you relax that pelvic floor to help you have a bowel movement without straining. So the higher your knees, the better. So no straining, no sitting for long times. Get those knees up. You can get a squatty potty, but you don't need to. You can just try a box first to really try to get those bowel movements out.
When I first got one, I was like, I could just put a stool on here, man. Like,
yeah, you can turn the garbage can sideways. I mean, like, yes, all of those things work.
all right. Okay. Now, next, you talked a little bit about it with the fiber supplements, but are there any other over-the-counter remedies or supplements you recommend? Now, of course, we know these are medical suggestions. We definitely recommend you make an appointment with your doctor to talk about a good fit for you. But, Doc, what other over-the-counter remedies do you recommend for someone who's like constipated?
Yes. So my first go-to is what we would call after fiber and water is an osmotic laxative. So there are lots of different types of laxatives. The osmotic laxative that most people have heard about is something called Miralax. The drug name for that is polyethylene glycol. So what Miralax does is your body does not absorb it. When it goes in, it comes out. And what it does is similar to fiber. It draws in, through osmosis, it draws in water from the blood vessels into the GI tract, again, to lubricate the stool and help you have a bowel movement. So again, Miralax works best when chased with hydration. And the reason I like Miralax to start with is because you don't get a tolerance to it. So for example, let's say you only need 1 dose of Miralax to have your 1 solid bowel movement per day. That means that is probably all you really need. You won't need, 2 months later, 2 doses of Miralax, and then 2 months later, 4 doses of Miralax. And the reason I say this is because I'm going to get to that with the stimulant laxative. So I like Miralax because you take it, you drink a bunch of water, and it helps you go. What I will say about that is it's not great for like, I'm really plugged up and I need something to get me going. This is a good maintenance medication. So you can probably take a couple and it'll kind of get you unplugged. But if you suffer with constipation, Miralax is sort of the maintenance medication that I would recommend. Now, the other kind of laxative, which I do not recommend for chronic use, is a stimulant laxative. That's like bisacodyl, senna, anything that says senna. So you probably get this. I get this a lot. Patients are like, oh, but it's natural. Senna is natural. It comes from a plant, the sinusoid plant. But the way it works is it works on the muscles that are in the wall of the colon, and it stimulates those muscles to like really crunch down and contract, right? So it doesn't matter what's in there, it's going to crunch down. And so this can lead to cramping and also that can lead to tolerance. So let's say 1 senna gives you relief. And then 6 months later, you're going to need 2. And then a year later, you're going to need 3 for the same result. And then suddenly they're not going to work at all. And so stimulant laxatives, you develop a tolerance and a dependence on them. What I do recommend a stimulant laxative for is for those times where you're like, I am so plugged up, like this is never going to end. And you just need something to kind of get you through so then you can get back to your maintenance. That's okay. To use it maybe 1 or 2 days in a row, even maybe 3 days in a row. But beyond that, I would not recommend chronic use of a stimulant laxative.
Okay. Thank you for that. There's a balance to it and there's a place for each one, the stimulant laxative, the osmotic laxative. So that's good. Now, what about magnesium? What are your thoughts on it? Is it glycinate or one of the two?
Yeah, there's lots of different magnesiums. I'm not super well versed on it, but what I will say is, you can find things like magnesium citrate, which is that will, if you take the entire bottle of mag citrate, first of all, it doesn't taste very good at all. But if someone does, this is something where you're going to have to stay home or stay close to a toilet. This will give you something explosive, magnesium citrate. There are a variety of different types of magnesium. people who take magnesium sort of on a daily basis and that alone works for them to have a bowel movement, I think that's fine. I think that's great. I don't think you get I've not seen patients get a dependence on magnesium or a tolerance, I would say, to magnesium. Maybe a dependence, but not a tolerance to the magnesium.
Right. Okay. With the glycinate, I think that's more muscle relaxant. So it doesn't work as well as the citrate. The citrate is good for the people.
Yeah, the citrate is explosive. So you gotta be prepared for what you're doing to yourself there. But also for a lot of my post-op patients, if they're kind of using the Miralax to have softened bowel movements and that's not working, I will recommend that they take 1 or 2 doses of milk of magnesia. Okay. And that also will kind of give people, again, not something I recommend as a chronic use, but that will kind of help sort of push things through if you're kind of stopped up as a, one-time situation.
What about enemas?
Yeah. So, enemas essentially clean out the bottom portion of your intestine. So your rectum and your sigmoid, which is the lower half of your large intestine. That can be helpful if you have a patient that has a sensation that they really need to have a bowel movement and maybe it's so hard or desiccated and it's a very large bowel movement and it's not going to come out because it's not lubricated enough. By then it's so far away from the mouth that the best way to get the lubrication is through the bottom. So enemas are, and I will say this, there are certain situations that are not a usual situation where people do have to do chronic daily enemas. This is not a usual situation whatsoever. And is generally for people that have maybe congenital like Hirschsprung's or things like that, anatomic reasons for it. But for people that have like a very hard stool that is not going to come out, an enema can be a good way to sort of lubricate that area in the rectum and get that stool out. Suppositories can also do the same thing. So anything that sort of stimulates the anal sphincter or the pelvic floor can also help relax it to get bowel movements out. And that's kind of what enemas are good for. Suppositories are good for that as well. Okay.
Anal sphincter, that's your butthole.
Yes. That's the muscle that kind of keeps everything in. Yes.
Dr. Ritha. All right. Now, what are your thoughts on colonic? I just thought to ask. I've had a few patients say, "Oh, I'm going to go for colonic." Do you?
I don't like them. I don't like them for a couple of reasons, but they're not necessary, I guess is what I would say.
Okay.
If your goal is to just clean out your entire large intestine, I can give you an over-the-counter bowel prep that I give my patients to give before they get a colonoscopy. Okay. There's nothing that needs to be cleansed out of your colon, right? So that stuff that's in there is already on its way out. It's no longer part of your circulating system that needs to be cleansed out. So what a colonic effectively does is it's like a large volume enema. It puts, stuff up. Let me use my little pointer here. It comes, up here and it cleans all of this out, all of this waste that was already going to come out. So there's no reason to do it because you feel like your body needs a cleanse. It's not doing anything systemically to you. It's just maybe accelerating the stool coming out. And there are safer ways to do that with medications. The other reason I don't like them is because the people that are administering them do not understand the complications that could come from sticking a tube all the way up someone's colon. There's always, it's probably low, but there's a risk of perforation. And you may not know that that's happened until a few days later with severe abdominal pain. You may need, you may need surgery. And these are not people that are physicians, nurses that know how to give enemas. These are not people that are, in my opinion, qualified to put anything up your bottom. And so that is why I don't really love them. I think the promise of a body cleanse is not really good information. And there could be some pretty bad complications from them if not administered properly. So, yeah.
So with caution.
Yes.
Thanks for the word of advice.
Yeah.
Now, when should someone get concerned? Like, oh yeah, as far as constipation, are there red flags at which point you say, okay, this is not something I should, do over the counter? It's time for me to talk to my doctor.
Yeah, sure.
Mhm.
So, anytime you have constipation that is sort of new, where you've tried the over the counter, you've tried the fiber, you've tried the over the counter things, and things just aren't getting better, they're getting worse. You feel like you're straining to have bowel movements, just things have changed. That is certainly a reason to seek treatment or to seek evaluation. That's number one. So a change in bowel habits is always, over not just 1 or 2 days, but if this has been going on for a few weeks, a couple of months, certainly you need to have that evaluated. The other thing is if constipation happens alongside other symptoms, so abdominal pain, severe cramping, severe bloating, intolerance to food, like you're not eating as much, you're losing weight, you're having any bleeding from below, your stool looks different. If it's like normally, like the size of a log, and then suddenly it's the size of a pencil, that's a reason to become concerned. If it changes color, that it's not normally brown and now it looks a little bit black, those are other reasons. So if it's constipation plus some other GI symptom or weight loss, that is absolutely a reason to get checked out.
Okay. Thank you so much. This has been very, 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 very rich. A lot of things to do as far as lifestyle, lots of things to do as far as over the counter. I like that we have options there. But Doc, I have people who are wondering where they can connect with you. Like, hey, I think I need to see my doctor for colonoscopy, or I need to go check out
Yeah.
constipation. Oh, I need to go take hemorrhoids. You do hemorrhoids too, correct?
Yes. That's they're like little buddies, constipation and hemorrhoids. They kind of hang out together. Yeah.
But Doc, where can people find you?
Yeah. So I'm in Houston, Texas. My office is in the Heights, Houston Community Surgical. You can go to my website. That's same thing, HoustonCommunitySurgical.com. Or I'm also on the various social medias, Ritha Belizaire, MD, on TikTok and Instagram. But I also will use this to put a plug in for your viewers to get a screening colonoscopy. A lot of people don't feel like they need to get a procedure done when they feel okay. And so it's really hard sometimes, especially now that the age is 45. The recommended screening age is 45.
Yeah.
And so if you feel good, it's kind of easy to put things off. But starting at age 45, all comers, screening colonoscopy, it's really not so bad. I can even send you the prep that I use. I did it myself. So now I could start telling my patients, I know it's not that bad because I did it myself, my own prep. And it's a nice nap. It's
Yes.
oftentimes, yes.
It's a nice nap.
It's a really nice nap. You feel fine, a couple hours later, you kind of feel back to your normal self. You can go back to work the next day. It's really, and sometimes then you're good for 10 years. So don't skip it. And then what I tell people under the age of 45, if you're not yet at screening age, you have a family history of colon polyps, a family history of colon cancers, please just see if you're maybe one of those high risk population that needs to get screened earlier, or if you have symptoms, bleeding, abdominal pain, bloating, anything like that really is not normal for you, especially if it's new onset, you may also be a candidate to get a colonoscopy sooner rather than later. So just a little plug for screening.
Beautiful plug. And like you said, it's a good nap.
It is. Yeah.
I was like, can I have 15
I know, exactly. A few more minutes. Where do I put the quarters in the machine to get a few?
Please. Oh my gosh. All right. I promise that I'll have my daughter come on the show.
Yes.
Too. So I'm going to ask you, so is there one thing you want to say about constipation for our viewers to help them? Okay. What do you want to say?
When you eat pears, it helps you not to when you don't eat a lot of pears or you don't drink a lot of water, sometimes your poop gets hard and sometimes it hurts to come out. So if we eat pears, it'll help it. If we eat a lot, it'll make it really soft.
That is brilliant. Yes, ma'am. Pears are where it's at.
I make her eat some pears. It helps. It helps a lot. But I was going to say this real quick. Dr. Ritha has great Instagram, like information on Instagram. I follow her stuff. I learn a lot too. even have patients go and watch her and
Oh,
see
thank you.
things. And so very, very, very good. Please, for those of you who know this has been helpful for you, you have people who are delaying on the colonoscopy who need encouragement. There's some people who are dealing with constipation, feel miserable for it, and they don't know what to do. Please share this with them. You can help improve their quality of life. But thank you, Doc, for coming. This was good. We're going to have you on probably in 6 months. Yes?
Yeah, I would love to. Thank you. It's always fun.
Awesome, awesome. But thank you all for watching live and replay. And as always, if you or anyone you know is looking for an awesome, a thorough, and a caring family physician in the Mansfield, Texas area, I am she. And if you're looking for a GI doc, she's in Houston, not too far from me. Okay? All right? Have a good one, everyone. Thank you for joining. Thank you so much, Doc. You rock.
Thank you.
You rock. This was good. This was